it's okay, honey. They've got to make sure it's okay inside.
Here on the front lines, the virus is already taking its toll, and the worst is yet to come.
Just rest, my love. You've been through so much.
4-year-old Ferris Laban is fighting a nasty infection at the University of California Davis Children's Hospital.
Ferris basically went from having the typical flu that we've all experienced over the years to a complete collapsed lung and pneumonia in a week. This virus, the H1N1, is completely aggressive. Come on.
His infection was so bad, doctors inserted a tube into his left lung in order to drain it of fluid.
It's amazing to me how much is still coming out of him.
Where's your back hurting, sweetie?
No part of the hospital is under more strain because the virus is striking hardest at children and adolescents.
We're really scared about the resources that we may have to use and what kind of toll it's going to take on all of our staff.
Sweet, we're going to put a pillow behind your back, okay?
Just 2 weeks ago, in Ferris's very room, bed number 1, we met Benjamin Obak, also infected with a severe case of H1N1. The 10-year-old, then in critical condition, was fighting for every breath while his parents prayed.
Lord Father, please continue the blessings of healing in this boy.
Like so many of these pediatric cases, Benjamin's illness involved care from every corner of the hospital.
He required pretty much all the different services within the children's hospital. When he was in the ICU, he needed the physicians, the nurses there. He needed respiratory therapists there, physical therapists. So really, he kind of uses all elements of our hospital.
You can do it, Benjamin.
Benjamin has now moved out of intensive care into the general pediatric wing. He is slowly regaining his strength.
How are you feeling today? Good. Good. Have a smile on your face, maybe laugh a little. Benjamin's really doing quite well. He's began his road to recovery from his illness. He's stopped having fevers. He has been able to get up out of bed, sit around, move around, and talk with family. And he's started eating again.
1, 2, 3, push!
While Benjamin seems to be getting better, the caseload for his doctor and the entire team here is growing.
We're going to start her on some Raglan, but she's chafing and getting a little sore there. Okay.
They're busy with 8 confirmed cases of H1N1 in children.
Well, let's go see her.
Up from 3 last week. But another 18 kids show symptoms that have to be checked out.
If they're hospitalized, it usually means they have fairly severe symptoms. So you have to begin treatment rather early in the course to really make a difference.
In each one of those cases, Dr. Laura Hufford must put on gown, gloves, and a special mask to protect herself and the patient.
How many times a day do you think you have to change in and out of these things?
Up to 40 times a day, I would say.
Can I take this?
In intensive care, Ferris's condition is improving. Now he must wait for a bed to open up in the crowded pediatric unit.
Pediatrics, the last couple of days, we've definitely had a waiting list, but we usually just have the patients wait in the emergency room that they're in, and when we have a bed, they come right up.
Any cough?
The emergency room is coping but crowded. This week, 28-year-old Sarah Carter came in feeling ill a day after her 4-year-old son had been admitted for H1N1. She had some of the same symptoms.
Yesterday, you have had a fever. Oh, I've had a fever.
Upstairs, her son Arista was being treated in the intensive care unit for a fever spiking above 104 degrees.
Is this difficult for you coming down with an illness while your son is in intensive care?
Yeah, it kind of makes me cry because I can't be up there with him because I'm sick too.
The already hectic emergency room is seeing 20% more traffic than usual because of H1N1. One big problem is what hospital staff call the worried well, patients whose fear of the flu is far more severe than their actual symptoms.
Pediatric phone advice. This is Veronica.
A deluge of concern from the public is flooding the hospital hotline, too.
Sounds like he may have an ear infection and flu symptoms, all right? I've seen many epidemics, but I think this is going to challenge all healthcare systems to the absolute max.
Already the pandemic is raising concerns practical and profound.
these masks. So we actually ran out on Friday.
Did you really?
And the state, Schwarzenegger released the stockpile.
The question is this going to continue to exponentially rise?
Here at UC Davis, this chart showing a 4-fold increase in H1N1 cases in just 3 weeks explains why the infectious disease team is planning for a big surge when the normal flu season gets underway.
Is there going to be a point where you're going to have to allocate very scarce resources and make very difficult decisions?
That point may come, and it is possible that we may need to start allocating resources based on prognosis of patients.
In other words, who's got the best chance of survival?
Correct.
Hey buddy, I have some medicine for you, okay?
Back in the pediatric unit, Ferris Laban is doing much better. But once admitted, patients can be hospitalized for weeks. On this day, his plans for going home hit a snag.
Ferris had a little setback last night. We were hoping that he was going to get to go home finally today after a week of being here. But his temperature rose to about 101 last night, and he was in a lot of pain within his stomach and side areas.
Come on, we gotta take the medicine. You took a cracker, so let's take some medicine, okay? Little medicine.
Right next door is Benjamin Obak, the 10-year-old who just 2 weeks ago was so critically ill.
Is it okay if we take a listen to your lungs?
Now the big day of his departure has finally arrived.
Just pick a breath as you can.
I'm feeling very excited. Finally get to go home and play.
Cough, cough.
But there is a hitch in his case, too.
Where does it hurt? Can you show me? Just kind of all over. Okay.
Benjamin has an inflamed pancreas, and he must stay in the hospital another day.
Benjamin was very sad at the news, and he cried, and I comforted him for some time afterwards, but he still wants to come home, of course.
By the next day, things are looking up.
The ultrasound today looked completely normal. I think you can go home today. Your pancreas looked pristine.
I'm feeling fantastic. I have a lot to look forward to.
For Benjamin and his family, the H1N1 virus has at long last run its course. Next stop, home sweet home. For Dr. Hufford and the medical team at UC Davis, it's just another difficult day in a battle that shows no signs of letting up.
I have 4 other children that have H1N1 yet to see today, and probably as soon as Benjamin leaves, his bed will be cleaned because I just got a phone call about another child with pneumonia.
This is Chris Bury for Nightline in Sacramento.